Hello, I'm Dr. Cooper, and today we're going to be talking about poor sleep and how it's causing or affecting your headaches. So, if you're like me and plenty of other people, sleep is sometimes tough these days, either not getting good quality sleep or just not getting enough of it. Um, yeah, a lot of people don't get their 7 to 9 hours, and then when they are getting their 7 to 9 hours, it's not the good quality sleep, like they're waking up to go to the bathroom, they're checking their phone at 2 a.m., they're not waking up refreshed in the morning. That alarm hits and they're not ready to go. So hopefully throughout this PowerPoint, you all kind of get some tips, some tricks to improve your sleep qualities. And if you are a chronic headache sufferer, hopefully you can get some tips to reduce the intensity of those headaches and preferably make them even occur less and less. So how bad sleeping habits cause headaches? So here we're going to be focusing on two main points: sleeping position and lack of sleep. So we're going to start by talking about sleeping position. So if you're like me, again, it's tough to hear, but sometimes the most comfortable sleeping positions that we are all in is not the best for our bodies. For example, I used to be a stomach sleeper. The only way I could fall asleep is on my stomach. But unfortunately, that is the worst possible way to sleep, because if you think about it, you have to turn your head one way because you're not just going to be face down. That's overstretching these muscles, putting a lot of tension on muscles while we're sleeping. And like when we're sleeping, we're supposed to be relaxed. We're not supposed to be putting stress and tension on all these different muscles. So we'll talk about sleeping position a little bit later on. And then next up is lack of sleep. Like I touched on, we're not getting enough sleep, not good quality sleep. And there's numerous studies that show lack of sleep decreases your pain threshold. So like everyday kind of like aches and pains that normally you wouldn't even notice, when you're sleep deprived or lack of sleep, those aches and pains kind of feel like a whole new injury, and it's like super painful because your pain threshold is just so much lower. So how do I sleep versus how should I be sleeping? So kind of like we touched on, stomach sleepers is the absolute worst, because you're in an unnatural position. You overstretch the muscles, you're twisting, turning your neck. Side sleepers aren't as bad if done the correct way. So if you have the correct pillow that's a little thicker, side sleeping is okay, because if it's a little thicker, your head's still aligned with your body. But a lot of us use kind of thinner or not the correct pillows. So then when we sleep on our side, we still have that turn in our neck, not a natural position, which is going to put unwarranted stress and tension on these upper back and neck muscles while we're sleeping. And then we don't want that. And then, unfortunately, the most perfect natural position for us to sleep in is on our back, which I know is not always the most comfortable, but then also with a cervical pillow. So a cervical pillow is kind of like raised on the outside and then kind of like indented or flat on the inside. So what that does is it helps with our cervical curve. So like all day, kind of like I am right now, looking at our phones and stuff, our head's forward. So what the cervical pillow does is help us get our head back more in a natural position. So then that allows our muscles to relax, not be so tense. So why is this so important? I mean, it's so important because we're so stressed throughout the day. And when we sleep, that's supposed to be our time to relax. So if you work a desk job or you're looking at a computer all day, looking at our phones, and like we're already putting stress on our muscles up here, like if we can't relax our muscles when we're sleeping, when are we ever going to relax them? And we use sleep to repair, recover, get ourselves ready for the next day. So if we're not repairing ourselves while we sleep, we never are. So there's two different types of headaches that sleep usually affects. So sleep positioning is usually more with the tension headaches, and then lack of sleep is more with the migraine headaches. So tension headaches, it's kind of like not so much painful, but it's kind of like a dull, irritating type thing. It's usually like a band of stress across the forehead. And that kind of comes just from tight muscles in the name, like a lot of tension up in the upper neck. And then migraine headaches, that comes from lack of sleep. So there's numerous studies that show lack of sleep increases migraine intensity, and it also increases the occurrence of these migraines. So migraines, we all know, like the debilitating in the room, lights off, head is pounding. It's usually one-sided, can be triggered by lights, sound, smell, you name it. So there's probably like a million reasons why you can't sleep, but the three big ones we're going to touch on today are stress, pain, and circadian rhythm. So stress, anxiety, depression. In today's world, who isn't stressed between family, work, social life, all that stuff. So when you're stressed, it's hard to fall asleep because you have so much other stuff on your mind. It's hard to relax, get the brain calm, and be able to get a nice, peaceful sleep. Same thing with kind of pain. If you have like knee pain, back pain, neck pain, it's hard to relax before you go to bed because you're thinking of that pain. You're trying to sleep and you're not relaxed because you're in pain. You're thinking about that. And then what I think is the most important one is circadian rhythm. So we'll touch on that a bit later, but circadian rhythm is pretty much your body's internal clock. So it tells us when we wake up in the morning and when we go to bed at night. And today we do a lot of things that are going to disrupt that circadian rhythm. So how to fix these sleeping habits? A common one, reduce stress. So it's good to get out and exercise. I'm not talking about like running a half mile every day or like a half marathon every day or bench pressing 300 pounds in the gym every day. Just try to get out and do something active. If it's go for a walk or just get up and move around a little bit, get the blood flowing. Touching back on that circadian rhythm that I was just talking about, our bodies are made to move around during the day. So like if we're just sitting around not doing anything during the day, then it comes nighttime and we're trying to go to bed, our body's like, whoa, we didn't do anything the whole day. Like, am I supposed to be active now or am I supposed to be going to bed? Next, yoga, loosen up those muscles, get your body in the proper positions. Meditation, work on your breathing. Just take 10 minutes a day where you don't really think about anything. Just keep a clear mind for like 10 minutes a day. Something that I started doing that's really been helping me is I journal or just talk by myself or with someone before I go to bed. If you're weird like me and you close your eyes at night, you just think about the most random things that happened like 2 years ago or like what's going to happen in like 3 years. If you journal or talk to someone about this stuff, you get that out of your head. So you're not just thinking about it all the time in your head. You're kind of putting it on paper, saying it out loud. So it puts your mind kind of at ease and you just don't think about those random things before you go to bed. Next is things to reduce pain. Chiropractic care. If you're misaligned, your body can overcompensate, causing, if your pelvis is out of alignment, it can cause low back pain, which is going to cause mid back pain. Maybe your neck overcompensates. So get adjusted, get aligned, make sure your body's functioning how it's supposed to. A massage, loosen up those muscles, get those knots out. CBD oil helps with inflammation, relaxation, decreases pain. And then like we talked about the cervical pillow, get that curvature right in your neck, help relax those muscles. Next is fix their circadian rhythm. So the best thing you can do for their circadian rhythm is to go to bed at the same time every night and wake up at the same time every morning. I know that's not realistic for a lot of us, but if we can get as close to that as possible, it will really help. I mean, if you go to bed at 9 p.m. one night, 11 the next night, 1 a.m. one night, like our body's never going to be able to comprehend when it's supposed to go to bed. Try to get on a schedule, get our body used to going to bed at the same time. Again, it's not always possible here in the Midwest, but get sunlight. Circadian rhythm, our body's internal clock. If we go outside and our body sees the sun, we're telling it it's daytime. Electronics before bed. So electronics give off a blue light energy. The sun gives off blue light energy. When we're on our electronics, we're pretty much telling our body it's giving the same energy that we get from the sunlight at times. So before you go to bed, if you're looking at your phone, your internal clock's like, oh, am I getting this energy from the sun or what's going on here? It's just going to confuse your body. So try to, take 2 hours before you go to bed with no electronics. And then that should really help you be able to fall asleep at night. Another one is caffeine. You don't want to drink caffeine 8 hours before you go to bed. So a cup of coffee in the morning, sure. But maybe if you have trouble sleeping, try to cut back on that second cup in the afternoon. Another good thing is if you're a chronic headache getter, keep diary of your headaches, when they occur, the time of day, if there's certain days that they do occur, how many times a week you're getting them. And then not only that, but how do these headaches feel? Do they all feel the same? Do some feel different than others? Did something cause it? Did something in your everyday routine change? If you jot all this down, you can, like, after a few weeks, you can look for patterns. If you didn't do something one day and you got the headaches, or vice versa, if you did do something one day and got the headaches, or if you didn't get the headaches, if you keep track of all this stuff for a couple of weeks, it may seem like obvious when it may not seem obvious when you're like talking out, but if it's all just written down in your diary, be like, oh, I didn't drink water, a lot of water these 2 days, and I had a really bad headache on this third day. Then if you see a correlation, maybe it's due to water intake. Or same with sleep. Maybe you didn't get great sleep for 2 nights, and then you had a really bad headache on that third day. And then you keep seeing a pattern. Then you know what the problem is, and you can address that problem directly and fix it. So benefits of chiropractic care: relieves pain and discomfort, releases tension and stress. Back to, the spine. If it gets misaligned, it's going to cause body to overcompensate, tension on one side, overcompensate, more tension on the other side. Chiropractic care can, get your body aligned and get everything in balance, relax the muscles, allow the body to heal itself. It improves blood flow, and increased blood flow is correlated with relaxation. There's also studies that show adjustments decrease cortisol, which is a hormone your body produces when you're stressed. We can also evaluate sleeping positions. There's numerous times where patients come in and get adjusted. They're like, yeah, I feel great after the adjustment, but then like I wake up in the morning and like I get pain again. We're like, okay, well, how are you sleeping? And then they tell us how we're sleeping, and we just, all that tension in the neck, that's why they're sore in the morning. Then we tell them about the cervical pillows. They start sleeping on their back, or a raised pillow to sleep on their side. And they're like, oh my gosh, like it's night and day. I feel good after the adjustment, and it like holds so much longer now that I'm sleeping in the proper position. And also, you would be less prone to sickness and disease when your body is aligned. So nothing's more with allergy season coming up, nothing's more annoying than when you're laying in bed and you have one nose stuffed up, one nostril stuffed up, another nostril is not. You're breathing through your nose and you can only breathe through one of them. Most annoying thing in the world. So a little recap here before we end it. Lack of sleep decreases pain threshold, makes aches and pains way more irritating than they need to be. Sleep positioning. We're supposed to repair, relax, recover, get ourselves ready for the day. And in poor sleep positioning, we're not recovering how we need to, because we're just putting added stress to these muscles. Stress, circadian rhythm, main factors why people stop sleeping. Exercise, get sunlight, try to go to bed, try to wake up at the same time, limit electronics, get that circadian rhythm intact. Diary, keep track of all your headaches, what you're doing differently, what you're doing the same, what didn't you do. Look for patterns, try to find the root cause of your headaches. And lastly, chiropractic care. Get adjusted, get your body aligned, let your body function how it's supposed to be functioning.